My name is Christiana Igbe. I'm a volunteer curator at Pioneer Medical Initiative. Welcome to CuratorsCrib. Pioneer Medical Initiative is a non-profit and youth-driven health organization focused on promoting healthcare inclusion, accessibility, and affordability. All of this is towards the quick achievement of the United Nations Sustainable Development Goal 3 and Universal Health Coverage Agenda. Now, we journey towards this goal through healthcare advocacy, activism, innovation, research, and technology. And we believe that the right to healthcare is just as important as the right to life, and that a threat to this right is a direct threat to life, and as such, requires effective interventions. Let's talk about our vision and mission. Our vision is to build an Africa where there is inclusive, affordable, and accessible healthcare for every individual with equitable distribution of primary health care. And our mission is to improve the health of low-income earners in rural communities and marginalized groups in Africa. Currently, at Pioneer Medical Initiative, we have 6 major networks. We have Pioneer Network Futa, Pioneer Network Shagamu, Pioneer Network Ile-Ife, Pioneer Network Lautech, Pioneer Network Lagos, and Pioneer Network Funab. All our network members focus on our goal, which is to promote inclusive, affordable, and accessible healthcare. Pioneer Medical Initiative is an organization with different teams, all focused on our goal. We have the admin and human resource team, we have the brand and communications team, we have the research and learning team, we have the project and programs team, and we have the product and technical team. Now to our organization core values. Our core values are excellence, sustainability, community and social development, leadership, love, fun, creativity, and volunteerism. Now to the most interesting part of this video, our programs and projects. First, I'm going to be talking about our annual bootcamp. PMI Curators Bootcamp is an annual capacity building and networking program for young health volunteers and experts working to improve access to healthcare in underserved communities. The bootcamp seeks to identify, train, and empower young adults to solve persistent and emerging issues in their immediate or deployed communities. Now let's talk about Health for Rural. PMI Health for Rural project is focused on the provision of primary healthcare services and establishment of resident healthcare facilities in rural communities only. This project also includes training the youths from these communities who will be involved in the resident healthcare facility to be established. This, however, does not include the provision of advanced medical services. Likewise, this project does not include urban communities where one or basic healthcare facilities are already available. Now, our monthly live session. PMI Live Session is a monthly program aimed at youth development, networking, and training toward a better contribution to universal healthcare and the attainment of SDGs. It is not limited to our curators alone, but open for participation to as many youths that be interested in personal enlightenment and knowledge sharing. It aims to facilitate growth and development among youths, broaden the knowledge horizon of young innovators, and to increase youth awareness about healthcare equity and innovation. PMI Monthly Digest. As part of its commitment to the professional development and growth of its curators, PMI organizes a monthly learning session exclusively for our volunteers. This program is focused on fostering interpersonal skills of curators and providing them with the opportunity to enhance their leadership and communication abilities. This session involves presentations from curators selected from our networks on topics related to healthcare delivery, innovation, and the sustainable development goals. Let's talk about Project Document the Undocumented. Document the Undocumented is a spin-off of the advocacy arm of Pioneer Medical Initiative, and it is directed towards the provision of a sustainable, qualitative, and equitable healthcare system in Nigeria. The ultimate goal of this project is to promote the incorporation of the accurate health data of the members of unreached rural communities in the Nigeria healthcare system and database. This project is a tech-enabled intervention and has been executed in some part of southwest Nigeria, and it included hypertension, diabetes, and hepatitis screening for people in these selected rural communities, and creating a well-aggregated database for their screening results using MedIQ, a health management software developed by PMI. With Document the Undocumented project, we aim to project these communities into limelight and to ensure that the healthcare system of these communities are given as much attention as their counterparts in the metropolis. Now let's talk about Project HELP. Project HELP is focused on providing access to medical oxygen in rural and peri-urban communities in Nigeria. This is a strategic partnership between Pioneer Medical Initiative and HealthPort Africa. The goal of the Project HELP is to build health system resilience and save lives through the ready availability of medical oxygen produced by our climate-friendly oxygen setups. It involves the training of healthcare workers working in rural communities on the administration of oxygen and using oxygen banks and other methods, and also grooming them on how to identify and stabilize patients requiring medical oxygen. Finally, let's talk about our genotype and blood typing for rural communities. This project seeks to lead widespread screening and awareness of genotypes among women and men of childbearing ages in rural communities in order to stop the sickle cell disease. Children will be screened for early/late diagnosis of the disease. Women and men will be further screened for their blood groups. This is to facilitate quick access to blood transfusion in the occurrence of medical emergencies. And we believe that the knowledge of blood group will improve the ease of finding matching donors among men and women as well. Now, let's talk about our traction over the years. In 5 years, we have remained relentless in impacting rural and underserved communities, specifically with the commitment of over 350 youth curators across the nation. Over 5,000 individuals have been screened, over 10,000 low-income earners have been cared for, and over 25 communities have been reached. Thank you very much for watching. I hope you learned something, and I hope you.